Hello, everyone. Thank you for joining us and welcome to our advocacy project. Advocacy in dental hygiene is crucial. Our goal is to influence policy for better oral health care for the public. This can ensure that dental hygienists will provide the highest standard of care to diverse populations. Today, we will be discussing the importance and the need for hygienists in Canada to use IST in public health areas. This will minimize and reduce the stress on our current healthcare field, specifically in underserved populations. A member of the public, for many reasons, may be unable to receive a permanent restoration for advanced decay right away. This may be due to many reasons, including finances, fear of the dentist, residing in a remote area, lack of health literacy, and many more. When a cavity is detected in a public health setting by a dental hygienist, the clinician is to simply document and refer the client to a dentist. Dental hygienists can be doing so much more in the chair to alleviate the client's symptoms by placing a temporary restoration prior to referring the client to the dentist for a permanent restoration. This brings us to our thesis topic. Through implementing IST in the public health across the Niagara region, we would reduce oral health disparities within the community and alleviate the strain on the medical system. The results of our advocacy efforts will be potentially meeting several human needs, including freedom from fear, freedom from head and neck pain, biologically sound and functioning dentition, and freedom from health risks. It is within the dental hygienist's scope of practice to do more than simply refer.
So, interim stabilization therapy stops the process of decay by providing temporary support on the cavitated tooth structure. Like the name suggests, the therapy is meant to stop the process of decay only for a period of time until a dentist can rectify the tooth structure with a permanent procedure. So, the benefit of IST is that fluoride is released into the tooth structure when it is applied, and the client does not need to undergo any freezing for this treatment. So, approximately 10% of 1,100 Canadians surveyed expressed that they were somewhat deterred or afraid of dental treatment. It was also indicated that 7.6% of the same group surveyed that dental fear or anxiety was the main reasoning as to why they avoided, canceled, or did not attend their dental appointment. So, when considering the causes of dental phobia and dental anxiety, the main chief complaints included the fear of pain, fear of needles and injections, and the fear of local anesthetic side effects. So, also the fear of drilling and sounds and the lack of control in this survey. So, the use of IST greatly decreases the incidence of dental phobia and dental anxiety through being a procedure within the dental hygiene scope of practice that is not invasive, meaning it is not painful. This procedure instead diminishes any pain, avoids the need of local anesthetic to numb the oral cavity, and then in turn, this avoids the use of any needles and does not require the use of drills or loud noises to apply the product, according to the ODHA.
So, reasons why someone would be a part of an underserved population would include socioeconomic status, income, immigration status, religion, ethnicity, age, and employment, and many, many others, such as health literacy, overall health, etc. When it comes to the proposition of increasing the use of IST within our chosen demographic, which is more so children, we did want to touch base on what the underserved populations look like within Canada. Currently, the stats showed that about 61% of children who are uninsured are unable to go see a dental professional for care due to financial barriers, and this is 22% for Indigenous populations. This would also include access to resources and the availability of dental professionals, given that Indigenous populations tend to be more secluded with less access to things such as a city dweller would. In addition, seniors were seen at 40% to have not sought dental professional care due to financial barriers. And then the last group kind of encompasses the untouched adults. So people who are uninsured, are refugees, and immigrants. So that starts at a base percentage of 26% who have not sought dental care because of finances. And 51 of those are a part of the lowest income bracket within Canada. So a huge population and a diverse demographic of people who are unable to see dental professionals due to financial barriers, which is why the use of IST, given that it is more so through the use of RDH care versus dental care, it allows it to be more accessible, more readily available for the public in order to do more good temporarily until an individual is able to seek professional dental care once they're either more financially stable and have the funds to do permanent restorative care, or until they have access to a dental professional. So because we want IST implemented into the public sector so it's available to the underserved populations, we have to look at the stakeholders involved. With our topic, the stakeholders that we have to assess would be the taxpayers, because it would be their tax dollars included with government funding that would ultimately fund this project in order to implement it nationwide. As well, we would need to look at public health workers, as we would need dental hygienists available who are trained in IST to provide these services at a caliber that allows a reduction in the stress in the healthcare system and to be filling that deficit of need for our underserved population with IST. In addition, another perspective would be that from the provincial and federal government, as they would need to assess the need requirement, the financial commitment, and whether or not it is worth the differentiation of funds into a new project that includes more dental care. And finally, the last two are our hospitals and clients. Hospital systems can be overwhelmed with dental emergencies when people are unable to or have not had the habits of going to a dental office consistently, and therefore they only go when there's an emergency. And then finally, our clients, because we want to make sure that we're filling the deficit for those who need dental care but have other barriers in place, such as financial barriers, that they are having issues overcoming.
The dental hygiene process of care is a system in which the dental hygienist follows steps to ensure the client receives the best possible care, beginning with assessments and then moving on to diagnosis, planning, implementation, and evaluation. Advocacy is integral to the dental hygiene process of care because as care is being provided, you're also advocating for your client to reach optimal oral health. By advocating that more hygienists participate in using IST, especially in public health, we are actively addressing a deficit that impacts people's well-being, health problems, and ability to function in day-to-day life. Even as it is a temporary alternative to care, it buys the client time while the individual can look for a permanent resolution at a later date with the dentist.
Considering current publicly funded dental programs, government programming which is available includes the Canada Dental Care Plan, or the CDCP, as listed under Basic Services, which includes service coverage of temporary fillings. Under the CDCP Dental Benefits Guide, there is no indication of the frequency of temporary restorations that are covered, nor the criteria of a tooth for a temporary restoration. This is available to all residents and families of Canada. The CDCP operates by the Canadian government on a federal level. Under the eligibility criteria, a candidate must not have access to dental insurance, have contributions of a net family income of less than $90,000, be a Canadian resident considering tax purposes, and have a tax return filled out from the prior year. Unless families are making less than $70,000 net income, which is covered at 100%, 40 to 60% is covered by establishment fees. Although this government plan is predicted to assist with financial challenges, This possibly still presents barriers to those with financial challenges who do not make the 100% coverage cutoff. Services covered includes preventative, diagnostic, restorative, endodontic, prosthodontic, periodontal, and oral surgery services. Despite the coverage of these services, several services include observed limitations. An example includes the frequency of scaling for those aged 17 and over, as the maximum amount of scaling that can be provided within a 12-month period is 4 units, this not being client-centered and presenting the issue of restricted dental hygiene care. Another government program which is available to the public is Healthy Smiles. It is a program that provides dental hygiene care for pediatrics, including temporary fillings under restorative services covered. Under restorative services covered, the frequency of coverage for temporary restorations is unlimited, meaning a pediatric client can receive as many temporary restorations as necessary. This program is only open to those who are under 17 years of age and operates through public health at a provincial level. Within the eligibility criteria, a candidate must be under 17 years of age, be a resident of Ontario, and are members of a household that meets the requirements for the income eligibility. There are no current details featured on the Healthy Smiles Ontario website touching on household income eligibility. Services covered by this program includes examinations, assessments, radiographs, anesthesia, preventative, restorative, endodontic, periodontal, prosthodontic, and oral surgery services. Healthy Smiles Ontario provides an adequate frequency of coverage of services. The only service which could be portrayed as limited is scaling, this being up to 1 unit for those age 11 and under, and up to 2 units for those ages 12 to 17. Yet it is stated more time may be allotted if a dental provider determines it's necessary. A third government program available is oral health screenings mandated under the Ontario Public Health Standards Act. This is available to all school-age children and is free of charge. The purpose of this screening is to catch early signs of dental disease, and referrals are made if there is an abnormality or finding, as they do not replace a standard dental examination.
Currently, oral care has been a hot topic in the media due to the introduction of the new federal government dental care program. Unfortunately, there is an ignorance among the public and politicians because there is a lack of knowledge and understanding of dental hygiene. The role of a dental hygienist is to provide palliative care, for example, providing interim sterilization therapy, which is a non invasive procedure for dental decay. Although there is not a lot of traction regarding IST in the media, the ODHA has supplied an article discussing IST and its prevalence. The article Interim Sterilization Therapy, and this edition is from 2016. This conveys knowledge about the importance of IST to the public and explains what it is and how it is used. Dental hygienists have an important role in education and providing non invasive interventions for unmet oral health needs. Lack of access to oral health care can have a serious effect, including progressive dental disease and missed dental days. For missed work days and school days. As the new government plan continues to improve, there should be an increase in media coverage for individuals who do not know of um, government supported programs to help alleviate the impact on the healthcare system from dental emergencies. Most emergency hospital visits are for preventable oral health care conditions. Current and future registered dental hygienists should advocate for more media coverage for preventative care universally, but most importantly to the underserved populations.
Okay, so how can IST improve public health? So, just to go over some statistics of what we in Canada are currently struggling with. So, according to the Canadian Health Measure Survey, almost all Canadian adults have experienced tooth decay throughout their lives. Furthermore, about 60% of Canadian youth have experienced or are presently experiencing some form of tooth decay. And we know that this can be averted with preventative interventions. And then almost 20% of Canadians have decided not to see a dentist or have not undergone all treatment suggestions because of how expensive these interventions are. So these next statistics we've mentioned in a previous slide about how this survey was saying how 10% out of 1,100 Canadians expressed they were deterred because of the dental treatment, and then 7.6% of the same group because of anxiety. And then the next statistic, just to briefly go over, because we've already mentioned it, they were a reason why was because of local anesthetic side effects and the fear of drilling. And again, this improves public health IST because, as mentioned in a previous slide, this greatly decreases the incidence of dental phobia and dental anxiety through being a procedure within the dental hygiene scope of practice that is non-invasive. So we don't need to use the drills and the local anesthetic. So we're not inducing that dental phobia that occurs with regular fillings and cavities and filling cavities, whereas IST does, we don't have to do those things. So this is definitely like a big reason why we are advocating for IST to be implemented into public health and why it can improve the health of the public.
So, why should we advocate for the use of IST in public health? Currently, the trend appears to be that private sector dental expenditure has risen to over $18 billion from 2010 to 2023, while the public sector has only risen from $714 million to $1.1 billion over the same time frame. The funds aren't going where they should, especially based on the need and demand of publicly funded dental programs for people to access. Although Canada has begun implementing these funded dental coverage programs, the truth of the matter is that the available coverage does not paint a consistent picture with the needs of the public. When we assess what is covered under the new programs, such as the CDCP, many of the requirements are limiting access to Canadians, and the services covered are not client-centered. And what we mean by that is that if a client comes in needing more than one appointment per year, which is what the majority of coverages cover is every 12 months for things such as new patient exams, specific exams, and radiographs. Clients who need consistent care do not have access to the same funding for those who may not need additional appointments within the same 12-year cycle. What this means is that this will then in turn deter clients from being consistent with dental care on a needs basis and will push them to waiting for care in order to not have to pay for it. The average household income in Canada in 2024 is $64,850, meaning that the average household would likely qualify for some sort of government aid, especially with dental care. A barrier of care in dentistry has always been financial stability, where about 25.9% of adults have avoided dental visits when they needed them due to financial restraints. And in 2019, it was stated that children without insurances were reported to visit the dentist at a 60.8% frequency, while those with insurances visited at a 92.2% frequency. So already from what we see is that the need for public funding or public access to healthcare, with the discrepancies of how much financial support is being put in these public sectors, has impacted people's wants and needs and abilities to access the dental room when needed. Whereas IST, which can be done by RDHs versus seeing a dentist on a temporary basis to soothe and treat caries or pain or trauma, could go a long way in filling that deficit for our underserved populations.
In conclusion, the process our group completed during the research analysis went relatively well. We found that the 3 articles we explored greatly supported the further need for advocacy efforts of the dental hygiene profession, along with the success and benefits of interim stabilization therapy. Certain barriers our group faced exploring these topics included limited research on IST as a dental hygiene procedure offered, along with a great lack of public awareness of this topic. Being that there is limited public knowledge and politician discussion regarding IST and temporary restorations, this itself serves as a challenge in advocating for further implementation of IST, as the public and politicians are not educated on this topic. Therefore, they do not understand the importance of IST. This serves as a barrier since it may be difficult to have the public and politicians understand why these procedures are crucial to the overall health and wellness of the general population. Overall, after deeply analyzing and reviewing the 3 articles our group selected, we have concluded that there is an evident need for IST services in public health provided by dental hygienists.